Welcome to the brain body exercise presentation of hip exercises performed in the side lying position. This video presentation is one of a series of videos that provide detailed instruction in exercise and movement techniques. We call them brain body exercise because we recognize that in all movement the most important factor is learning to precisely control your muscles and joints. This control of muscles and joints is done through the brain and the nervous system. Understand that everyone has a unique posture and body alignment. By doing the right exercises for your body in the correct manner, you will be caring for your muscles and joints over your lifetime. Not only will you train muscles and joints, you will also improve the functioning of your brain in its other tasks such as vision, hearing, taste, smell, and balance. It will also help with cognitive tasks such as memory, solving problems, and making decisions. How this works is explained in more detail in our Principles of Brain Body Exercise video, so watch that video. The intent of these videos is to provide some backup instruction to my patients. They have been trained by me in these exercise techniques. If you are not a patient of mine, please be sure that you get adequate instruction with a trained professional. A doctor with extensive exercise training is preferred. Also observe all general contraindications to exercise that may apply to any medical problems you have. Your physician may help you know what is safe for you. One last important point. Every human being has a unique body structure. Therefore, you will be best served by doing exercise movements that make your structure better, not worse. To know what exercises are right for you, you need a detailed structural and neurological analysis. Control of the hip socket is central to posture in all movement. People with back pain, hip arthritis, hip bursitis, or tendonitis, and many knee problems can be helped with these exercises. The exercises provide strength to many important hip muscles that are neglected by most other exercise programs. The gluteus medius muscle is an important muscle that stabilizes your hip joints and sacroiliac joints, which are often involved in hip pain and low back pain. It is directly strengthened by this exercise. The exercises also stretch the quadriceps, hip flexors, and hamstrings. All these benefits are obtained when the exercises are done correctly with attention to detail. Commonly, however, these exercises are done incorrectly. In this case, they can cause or worsen a low back or hip problem. So please pay close attention to the following directions and you will get a lot of benefit from these exercises. Here is the starting position for the side-lying hip exercises. Start by laying down on your side. You can lie on the floor or on an exercise bench as shown in this video. It is important that you align yourself so that your ankle, knee, hip, shoulder, and ear are in a perfectly straight line. Then lean your entire body forward so that you are halfway between lying on your side and your belly. This puts the muscles you are working facing towards the ceiling. You should keep your hips in this position throughout the exercises. You can put your hands in front of you for balance. All these alignment factors are critical to proper performance of the exercises. We will do 4 exercises from this basic starting position. Exercise number 1. Swing your top leg slowly forward and slowly backwards. Keep the knee straight and keep the leg parallel to the plane of the surface you are working on. There will be a tendency to drop the leg downward towards the floor as you bring it forward. This is because you are not used to this exercise and your hip muscles are weak. Go as far forward and backward as you can while keeping the hips aligned on the table. Remember, you want good form and not speed in this case. Exercise number 2. Bring the leg straight up and straight backward towards the bottom leg. Keep the hip turned in at all times. Keep your knees straight and move slowly. Here is exercise number 2 performed incorrectly. Notice that the hip is turned outward and the leg comes forward as it comes up. Exercise number 3. The top leg will come up and down just in back of the bottom leg. Again, keep the hip turned inward at all times and keep the knees straight. Move slowly and observe good technique. Exercise number 4. You make very small hip circles with the top foot. Keep the foot turned down, indicating that the hip is turned inward at all times. You'll definitely feel the muscle on the side of your hip with this one. Here's another view of exercises 1 and 2. Notice that the hips stay square to the table at all times. Now, I haven't addressed the number of repetitions to do with these exercises. Why? Because it's not that important. The form and the technique are much more important. My suggestion is to do the exercises in the order shown with good form until you are fatigued. In conclusion, I'd like to say that these hip exercises form a very important but neglected part of rehabilitative exercise for the hip, knee, and back. Please spend the time you need to get them just right. You'll feel the difference in your body. Should you have any questions, please don't hesitate to contact me.